Okay, and I am going to mute everyone. And so then Dr. Shaw, you'll have to
Okay. Okay, let me figure out how to share this. Sorry, I wasn't quite prepared.
At the bottom of the screen, you'll see a button that
Yeah.
says share.
Okay.
There you go.
Oops. And for those of you UIC folks, when Dr. Mitchell gets on, could you just let me know? And then okay, can you see my screen now? Okay. Hi folks. Thanks. My name is Ben Shaw, and I'm part of a UIC team that has been working on developing this pilot program for the last several months in collaboration with IDPH. And so we're happy to provide you with this session today. Also with us soon will be Dr. Mitchell, who is an associate professor from Community Health Sciences Division. Nancy Valentin, who's a grad student at UIC, who's also been a lead in one of the HEZs in Chicago before she became a student. And so she's a real valuable person on our team. Sarah Therian is also another grad student that you'll be hearing from. And then also, I don't know, Judith Sayer is here, or is part of our team, and she may be here as well. Lynette, who you heard from earlier, is part of the IDPH team that is launching this pilot program. Basically, we're going to give you a run through of what is the basic HEZ model, and then Nancy and Sarah will walk you through the particulars of this pilot program. Then Lynette will walk you through a bit about navigating the eGrams system, and then we'll have plenty of time for question and answers. Up until that point, while you're hearing from us, if you do have any questions, if you could just write them into the chat, and we'll just continue on with the presentation, and someone will be monitoring the chat and either answer those questions in real time or during the Q&A session. Okay, so is Dr. Mitchell here yet or no?
Not yet, I think.
Okay, okay, no worries. I'll start with just providing an overview of the health equity zone model. So basically, we know. Oh, Dr. Mitchell is joining right now. I just saw. So let me pause for a second, see if she wants to quickly take over.
Yes, I'm happy to. Sorry about that. Thank
No
you,
worries.
everybody.
I have control of the slides, so just tell me when you want to advance them.
All right, I'll just.
This is Dr. Mitchell.
Hi, everybody. I'm Dr. Mitchell, and apologize again for being a little bit late. But thank you for joining, and thank you, Dr. Shaw, for taking over part of my slides. So we're at the point where we kind of talk about the health equity zone model. And one of the things that we know is that there are longstanding health inequities, which are fueled by differences in social, environmental, and economic determinants of health. And they disproportionately impact communities of color, low-income families, rural communities, gender and sexual minorities, and people living with disabilities and immigrants, for example. And so the COVID-19 pandemic highlighted these inequities and really caused a shift in thinking towards health equity and public health strategies and interventions, where we provide support based on need and circumstances, as opposed to distributing support equally, regardless of need. So the health equity zone model is one of transformative model that really tries to leverage local assets and infrastructure to disseminate public health funding throughout neighborhoods to ensure that opportunities for health and well-being are just and equitable. These HEZs are structured as community engaged collaboratives with the long-term goal of supporting each zone as they develop into self-sustaining, self-funding entities that can respond to evolving community needs and priorities. So these collaborators will work together to develop action plans that address these social determinants of health or these root causes of health inequities. Next slide. So in short, what is a health equity zone as it relates to this initiative? It's a hyper-local geographic area within existing IDPH regions where opportunities to address health inequities emerge and investments towards this goal are made. Next slide. For the purposes of this NOFO, the technical definition of health equity zone is a collaborative of multi-sectoral partnerships existing in a contiguous geographic area that demonstrates measurable and documented health disparities and poor health outcomes, which, for example, may include but are not limited to high rates of maternal complications, newborn health complications, and chronic and infectious diseases, but contain populations that experience health disparities and is small enough for targeted interventions to have a significant impact on health outcomes and health disparities. Slide. So the HEZ model has been implemented throughout the United States at multiple levels, including at the state, county, and city levels. An example that is close to home is the Healthy Chicago Equity Zone Initiative, which, as Dr. Shaw mentioned, one of our team members has participated in. Chicago started the Healthy Chicago Equity Zone Initiative in 2021 as an extension of their work around the COVID-19 pandemic. There were 6 regional HEZs were funded and included a regional lead that managed the fiscal and administrative side of the HEZ, and multiple community leads within each region who focus on doing the work. All 77 of Chicago neighborhoods were represented in this model. And some of the activities that the HEZs focused on include citywide vaccination outreach and access programming, citywide distribution of fentanyl test kits, collaborations with restaurants to create diabetes-friendly menus, and many more. And you can see some of the results of their initiatives include kind of the number of surveys they've put out, the distribution of outreach material around vaccination to over 162,000 residents.
Hold on one second, Dr. Mitchell. One of our participants cannot see the slides. Is anyone else having that problem? Okay. So it might be that you may want to log out and then come back in, because it seems like
One other person at least who
right
said,
two.
should I maybe I'll stop sharing and try again? Are people seeing that?
I can see it.
Yeah. Christy Johnson still says no. What about?
Are others on the call able to see it?
You may want to sign back out and then sign in.
Because others are able to see it.
Okay. Shall we continue?
Yes.
Okay.
And these will be recorded, so I think there's opportunity to see them again. Yeah, so to tailor this HEZ model to the unique needs, assets, and demographics of Illinois, we at UIC conducted an environmental scan of other initiatives, including Chicago's, and collected survey interview data from a diversity of stakeholders, including representatives from local health departments, staff members from IDPH, leaders from different community organizations, which we broadly define as nonprofit organizations, schools and academic institutions, philanthropic organizations, faith-based organizations, and other entities that provide health and social services in the state. And you can see some of our key findings are highlighted on this slide, and just include that, participants would like to have somebody dedicated from IDPH or UIC to kind of help answer questions, which is why we're here. wanted special consideration given and support given to underserved regions, which we have incorporated into this NOFO, which we'll discuss later. Allow funding to be used to pay for staff positions, and that have incorporate some flexibility in who can actually lead the HEZ, which we'll also talk about later. Next slide. So now I will turn it over to Nancy to kind of give you the details about the pilot program.
Thank you so much, Dr. Mitchell. And I'll take the next slide, please. All right. Hello again. My name is Nancy Valentin, and I'm just really excited to talk about this piece of the program, which is the structure. And we're going to talk about what it looks like and what this development of the 2 health equity zones is going to be. So first, the health equity zones will be integrated within the current regions managed by IDPH. And these areas will be geographically defined, which means that they could be as specific as a single city, county, or zip code. And in some cases, it might even be a cluster of contiguous geographic areas, such as multiple cities, multiple counties, or various zip codes working together to address health disparities. So in short, you'll have room to define your community area. In terms of funding, the funding for these initiatives will be set in 2 phases or sets of activities that the awardees will be able to engage in. And the first part we're going to call the partnership development and planning phase. And then there will be an implementation and evaluation phase. But there will be one budget of up to $500,000 that should be submitted to cover both of the phases. So although there are 2 phases, there's really just one budget. And these funds will be crucial in really supporting the initiatives and strategies aiming at addressing the health disparities in your community and allowing for the promotion of health equity within the zone. So in summary, while this initiative is a significant step towards ensuring that your community has what it needs in order to have its optimal health. Next slide, please. So sticking with this phase 1, partnership development and program planning, this is where you're strategizing, where you're planning, and where you're collecting data. And this phase 1 will be competitive. So you'll have funding for the first 6 months of the planning phase that will be released initially. And this phase is really crucial in order to get the groundwork for your collaborative efforts within the health equity zones. So we're just going to take a gander here at the objectives. So objective 1, what we're looking here for is to aim and establish or expand, if you already have, a multi-sectoral collaborative of partners, which means you're bringing together at least 3 other organizations to work collectively towards these shared goals. And by nurturing these partnerships, you can gain diverse perspectives and resources, ensuring that you have a comprehensive approach to addressing the health disparities in your community. Objective 2 is looking into existing public health data. So some of us may be familiar with the State Health Improvement Plan, SHIP, iPlan, and other relevant data sets across the state in order to pinpoint that primary hyperlocal health data that you want to gather for your health equity zone. Identifying these key priorities and contributing factors is crucial for targeted and effective interventions. So what you'll be doing, and you'll have time to familiarize yourselves with these documents and collect your own hyperlocal data for this first part. And lastly, objective 3, the last goal in this phase, is to create a plan that is based on proven methods and solid research so that you have something that is able to be implemented. And this plan will include strategies to tackle the main health issues and the factors that cause them, that are caused in these zones. And using evidence and theories will make sure that your solutions work well and last long term. Next slide. And then in this phase, it'll be non-competitive, meaning that the funding will be contingent on how well the activities of the first part are done, and also on availability of continued funds. These deliverables are going to include the progress report, an action plan, evaluation strategy, and budget, among others. And after successfully completing this piece, you should be leveraging your collaborative for this second phase. And the duration of phase 2 will be a minimum of 12 months, no more than 15 months, starting sometime between April 1st and ending by July 1st, 2026. So let's dive into these objectives. Our main goal for objective 4 will be to bring your action plan from phase 1 to life. And we're talking about implementing your strategies and launching the initiatives that are actually going to make a tangible difference. And as you put these plans into motion, we want to keep a close eye on the progress and ensuring you're hitting the targets in order to make the impact. And plus, we'll conduct a thorough evaluation to measure how effective the intervention is and just make any necessary adjustments down the line to ensure that you have success. And this is really where the magic happens, transforming that vision that you put together into reality. And lastly, another critical objective is to develop a sustainability plan. So what happens after this? You want to create a plan that's going to help secure ongoing funding from both public and private sources. And this sustainability plan will ensure that your collaborative efforts continue beyond this initial pilot, addressing fiscal, personnel, and other resources that you need to maintain momentum. Next slide. We just want to make sure that you hear that we want you to focus on this first phase of the project, which means you really want to put a strong emphasis on how are you going to develop your collaborative, what it's going to look like, and really building time to form this multi-sectoral partnership and in order for the second phase to happen. So by the time that you're done with that first planning and development plan, you will have created an action plan with a detailed budget, and you would have formed the foundation for that work. And so it's really important that, and for you to know that it is expected and acceptable for the phase 2 plans to be a little less worked out, but again, you'll be creating your budget for both of those, and you really want to focus on how to build that partnership together. And that's the end of my piece. Thank you.
Okay, so I'm going to go over the details of the actual NOFO. Oh, wait. Nancy, I think these are still your slides.
Actually, we're just going to go over the funding details and eligibility.
Yeah.
My bad. Sorry, I forgot this whole piece. Great. So we want to make sure we get this right. Thank you for your patience. Oh, yeah, you can hear me. So we just want to clarify a couple of things. And so one of them is being that this pilot is really just 2 awards that are going to be handed out and are going to include up to $500,000 for both phases. And while cost sharing is not mandatory, it is allowed if applicants choose to contribute additional funds. And there's also an allowance for up to 15% in your administrative costs. So all your overhead can be up to 15%. And the applications can be submitted between November 1st and December 3rd. So that's coming up a little bit. So we want to make sure you have all this information. And the applicants will be notified of the award on December 19th, 2024. And in terms of looking at the program timeline, we're just going to take a peek here that the notice was made available on November 1st. On December 3rd, the portal will close, marking the end of the submission period, and then the review for the applications will begin. On December 19th, the review process will conclude, and the selected health equity zones will be notified. In terms for next year, in January 1st, the pilot will begin. And the selected health equity zones will start the planning phase, as we mentioned earlier, the phase 1. On June 30th, that piece of the planning phase will end, and then the health equities must report the deliverables to IDPH, the Illinois Department of Public Health, and UIC, the University of Illinois Chicago. And on July 1st, the implementation and evaluation phase is set to begin. And then lastly, on June 30th of 2026, the funding period for the pilot will end. Next slide. In terms of eligibility, we just want to talk about who can become a lead organization for the health equity zone. So these organizations that are applying are interested in taking the lead role in a local health equity zone, and those are the folks who are eligible to apply. The lead organization will be responsible for building and expanding the multi-sectoral collaborative, and this collaborative should consist of at least 3 partner organizations working within a common geographical area. Again, the zip codes you define, the counties, the cities, or a cluster of either or. And again, you'll have the chance to do that. And together, the lead organization, a local health department, and the partner organizations will form the health equity zone. Now, both local health departments and community-based organizations are eligible to lead the organization. However, if a local health department is not chosen as the lead, they must still be included among the partner organizations within the proposed collaborative. This lead organization should have the capacity to manage the fiscal responsibilities associated with their grant. And this lead organization should be physically located within the proposed health equity zone they are leading. Who are possible applicants? Corporations that are non-for-profit, government entities such as a local health department, and or a university or community college. And while you do not need to have all your partnerships selected at the time of the application, that allows you for flexibility to build your collaborative as you need to. You should at least name about who you would like to reach out to for this piece. And I think that was the last slide I already went through. Cool, that's it. Thank you so much.
Okay, so now I'll go over the components of the application. So on this slide here, you can see there are four main components: the scope of work, the work plan, the budget, and your health equity checklist. And the scoring for that will total 91 points. And like Dr. Mitchell alluded to earlier, we are adding some priority points for organizations or for collaboratives that meet certain criteria, where those areas might be under-resourced or other things. So we can move on to the next slide, and I'll start talking about the scope of work. So your scope of work is going to consist of 11 questions in total. The first 6 are where you will describe your organization, the lead organization, and your experience with different aspects of the program. So you'll be describing your organization, describe how you will form the collaborative, describe your experience with community-driven programs, describe your governance structure, identify your geographic area, and explain how your organization will benefit from participating in this initiative. Then we can move to the next one, and then your questions 7 through 11 of the scope of work are going to focus on your overall strategy for accomplishing the 5 program objectives that Nancy outlined for you. And this will have an emphasis on your plans for community engagement. For each of these objectives, you will describe what experience you have with that objective, how you plan to accomplish the objective, and how you will engage residents in accomplishing that objective. So on the next slide, we can see an example here. So for objective 1, you'll be describing how you will establish your collaborative, what experience you have establishing collaboratives, and how you will engage residents within the HEZ while establishing that collaborative. Then we'll move on to the next part, which is the work plan. And this is where you will describe more details about how you will accomplish these objectives. You will, for each objective, identify the key activities that you will engage in to accomplish that objective, the responsible parties or persons who are going to work on that objective, your expected outcomes, and your metrics for evaluation, and also the time frame that you will expect to engage in that activity. These will become the basis for your SMART objectives and your project plan. And we have a supporting document that's included in the application on eGrams with some recommended activities, outcomes, and metrics to sort of guide you if you would like to take a look at that. You can move to the next slide. And now we'll talk about the budget. So like Nancy explained, we have 2 phases for this project, but your budget is covering both. So the entirety of the objectives, essentially. Phase 2 funding is going to be contingent on successful completion of your phase 1 objectives and the availability of funds. While you are doing your budget, we want you to keep in mind that the lead organization is the one that will be managing the budget per purchases, subcontracts, and things like that. Subcontractor information has to be entered in egrams when you are entering your budget details. And there are some costs that are not allowable for this grant. Those are listed in the NOFO, so we ask that you please read that carefully to make sure that you're not budgeting for any of those costs. When it comes to the phases, your phase 1 budget should be detailed and justify your expenses for phase 1, which is developing your collaborative and conducting your needs assessment. It's important that you leave enough funding for your phase 2 while you're budgeting for phase 1. And so phase 1 funding should likely be less than your phase 2 funding. When it comes to budgeting for phase 2, you'll propose a budget that includes your best guess for your allocation of costs in phase 2. We recognize that your plans might change as you work through phase 1. Phase 2 might change, and you'll submit a revised budget in that case at the end of phase 1. In the budget narrative, we want you to please distinguish between phase 1 and phase 2 costs. We can move to the next slide. So just a couple more details here. We recommend that for phase 1, you allocate no more than 100 to 150,000 for those planning activities so that you have adequate funds for the actual implementation in phase 2. And in addition, when developing your budgets, please make sure that your funding is distributed between the lead organizations and the partner organizations in a way that recognizes the additional responsibilities that your lead organization has. We can move to the next slide. Okay, and then the fourth component of your application is the health equity checklist. When you are completing the IDPH health equity checklist, we want you to keep in mind that the quote unquote intervention strategy that is referenced should reflect the formation of your HEZ. That's the intervention we're talking about with this checklist. And this is basically an assessment of the health equity focus of your different interventions or developments of your HEZ. And that will occur at the end of phase 1. We can move to the next slide. So this is just an example of how you might translate those health equity checklist questions to be more relevant to this particular initiative. So you can see for objective 1, what persons or communities are most likely to benefit from the intervention strategy becomes what persons or communities are most likely to benefit from the formation of your HEZ collaborative. I'm not going to read through all of these for the sake of time, but they are on the slides if you choose to reference those later. And we have the next few questions also translated on the next slide. Yeah. And I'm not going to read through these either. Okay, we can move to the next slide. Okay, and then this is our last section, and this is where I'll talk about the prioritized applicant points. And this is up to 9 extra points if you're on your overall score. There are 3 categories in which organizations may or may not fit that would earn them these points. The first one is HEZs in Illinois counties that are designated as having medium high to high levels of social vulnerability according to the CDC SVI. That will be 3 points. Additionally, HEZs located in Illinois counties that are designated as rural by IDPH will earn another 3 points. A list of those counties is available in the NOFO. For the third criteria here, applications where the lead organization is a local health department and that local health department is in the bottom 25th percentile of IDPH operating budget, that will also receive an additional 3 points. That will be determined after you submit your applications by IDPH during the review process. So you don't have to really worry about that. And again, in total, that's up to 9 extra points. You may qualify for 1 or all or none. We encourage you to still apply regardless of that. Okay, we can move to the next slide. Perfect.
And so now I think Lynette's going to give us a quick walkthrough about navigating egrams.
Thank you.
Thanks.
We do have a question in the chat. What are the dates for phase 2? And basically the dates for phase 2 would most likely start July 1, 2025 to June 30th, 2026. I'm also going to remind you that our slides, frequently asked question sheet, and this webinar link will be posted to our website, and I've included the link in the chat. So for some of you who have not received any money from any of the state agencies, including Illinois Department of Public Health, you will want to do the requirements of your agency, or someone at your agency needs to complete the pre-qualification and pre-award requirements. This needs to be done in order to receive funding from the state of Illinois. There's a step-by-step guide listed at the link on this slide that I have in red. And how you can find that is if you go to the next page, at the very top, you would click on training materials, and you will see those links. Most of you, or probably a lot of you, have been in eGrams, so this will just go through pretty quick. So getting started in eGrams, you want to make sure that you register your agency, you create a user profile, you sign up. I encourage you all to sign up for grant opportunity notifications, because there are several notifications that go out throughout the year. So you'll want to sign up for that. Registering your agency, I have that in a purple box. Creating a user profile, I have that in the red, yellow. So you'll always see this over on the left-hand side when you're at the very first page of eGrams, which is at the Welcome eGrams. If you ever have any questions when you're filling out your application in regards to the navigation of the eGrams system, at the bottom of every screen page, you'll see in the red box is the Contact eGrams Help Desk. Click on that, be specific, take a screenshot of your question, and they will be able to assist you. They're very quick in assisting, and they will be helpful. Next slide, please. If this is the first time that you are submitting a grant application and in eGrams, then I highly recommend you to click on the training materials at the top of the screen, and then you will see the training webinars and guides. Those will pop up, and you will see at the very top, and that I have in the green box there, are links. The one is Getting Started in eGrams Applicant Guide, and the other one is the eGrams Instructional Guide Application, Entry and Submission. If you follow those steps, you should not have any issues in submitting your application to us, which the deadline is December 3rd. If you do have eGram questions, once again, click on that bottom screen that I have in red that says Contact eGrams Help Desk, and someone will get back to you. Next slide. Before you start completing the application, you'll want to go up to the Show Documents link. Click on that. This is what I had discussed earlier in there. I'm kind of getting ahead of myself. And click on that, and important documents that you will need to read before you start filling it out will pop up. So we had talked about, you go to the Show Documents, we talked about the NOFO. You'll want to read the Notice of Funding Opportunity in great detail. The budget glossary, there's some information in there that's what's allowable and what's not allowable. Also, the subcontractor subgrantee disclosure form is on there too. There's also another form, which is a guidance form that you'll see on there, which is a document that you will have seen that has been referenced in the NOFO that will help you in writing your SMART objectives and give you some ideas if you would like. Next slide. One thing that I do ask for the budget section is for personnel and services. We would like to know the actual staff people who are working on your grant and what their title is. So in order to do that, what you will do is you will click on the three dots. There you'll see it. It's with the red square around it. You'll click on the three dots and a pop-up box will appear. What you do is you click on the other, which is ZZZ, and then a box underneath will pop up, and then that way you will be able to type in the title of the staff person and then put their name. There's enough space to do all that. So we would like you to select other for all of the staff people that you want working on this grant. And then when the box pops up, mention their title and what their name is. If you know that you're going to have a caseworker on this grant, but you don't know who it will be because they're to be hired, you can put TBD, to be determined. And then if your application gets funded and when the grant starts, then we can make changes to actually get that person in there. Okay, that's all I have. Thank you.
Great. And so thank you for that, Lynette. Here you just see the links again to the NOFO and to egrams, just for your reference. So now I think we have a good amount of time for questions and answers. Oh, I saw a whole bunch added to chat from Karen. Okay. Do applicants need to have a local health department as part of the coalition? Yes. Or can another city or county government office meet that requirement, such as a housing office? At a minimum, you have to partner with at least one local health department. Other partners could be other government or other city or county government entities, like the Office of Housing, perhaps. But at a minimum, if the lead organization is not a local health department, then one of the partners has to be a local health department. The second question, in connection with the action plan, to what extent should a potential intervention be at least initially conceptualized at the time of submission versus starting from scratch with community during phase 1 of the award? So as we mentioned, when you're completing your application, you will be developing a work plan. And that work plan is asking you for your activities as they pertain to each of the 5 objectives. There are 3 objectives that are within phase 1, which is our planning phase, and 2 program objectives that are within phase 2, which is the implementation phase. So we expect that you'll have at least some idea potentially of what you're going to be doing in your phase 2 activities. However, we are hoping and even expecting that through your development of your partnership in phase 1, some of those ideas will expand or change to better kind of fit the needs of what the collaborative comes up with. So you may have these initial ideas. We don't assume that anybody's starting from scratch, but we do expect that you will leverage the partnerships that you are creating or enhancing to come up with even more nuanced or more comprehensive interventions that you would address in phase 2 of the initiative. Third question, do we need letters of support from potential partners at time of submission? Yes. Fourth question, can you provide the word/page limits for the various components of the application? I don't believe there are word, or are there, Lynette?
Yes, in egrams, it will tell you how many characters are available in each section. So in egrams, it will tell you how many characters are available in each section of the narrative parts. So if you want to use your Word, Microsoft Word or whatever your Word is, and put it in there and then copy and paste, that will help you.
Thanks, Lynette. Next question, should the work plan be in table format as shown in the slide? So what we were showing is kind of what the interface looks like on egrams. So if it's helpful for you to have it in that format, by all means, but you could also, for your own purposes, have it on a Word document in an outline form and then just copy and paste into the correct fields within egrams. But egrams, the way the table looks is activity. There's different boxes for this information. So that's just what we were presenting on the screen. Next question, do you have examples of projects that would fit with the program? I mean, we don't have examples per se beyond some of the work that other health equity zones have done. Chicago, again, is one example, but Rhode Island is one of the key places that started this initiative. And we don't provide examples because it's very flexible. And we're hoping that you'll use the time in phase one to really think about the needs of your community, of your geographic area that's kind of the center for your HEZ. And then think creatively among your collaborative about how to address the root causes or social determinants of these inequities for this initiative. So we don't have examples. We just want something that is focused on health equity, that is community engaged, and really leverages this partnerships that you are creating to do this work. Does that answer all of your questions, Karen? I hope so. Yes, okay, great. Next question. Is there a minimum and or maximum geographic area that needs to be covered by this project? No. The area geographically that's covered depends on you and your collaborative. The only kind of requirement is that the lead and the partner organizations are physically located within those geographic areas that you've chosen, but you are making a case for the area itself. So one of the questions on the scope of work is for you to describe the geographic area that covers your health equity zone, give us some information about the demographics and strengths and challenges that the population of interest is facing within this zone, and why it makes sense for you all to focus on this geographic space. So we aren't putting boundaries for you. You are explaining to us why your boundaries that you've created make sense, if that helps. It was late to the meetings. Oh, I was sorry. I was late to the meetings. I apologize. Who will be scoring the applications? Representatives from IDPH will be scoring the applications. That's all I can say because I don't know exactly who. Hope that gets your questions, Sean. Great. Any other questions? And feel free to unmute. You don't have to put them in the chat.
I'm just going to remind people before they might start to leave that in the chat, make sure you grab the link that Lynette left for that will take you to the slides. A link that will take you to the slides and an FAQ and a recording of this webinar.
Yeah. Thank you, Lynette. So we are going to stay on, but if there are no questions, the rest of you can probably take off. But we got 15 minutes over here for. When will the recording be posted, Lynette?
Hopefully sometime this week.
Okay, thank you.
I hope everything will be posted sometime this week.
Could this program be considered a planning grant for a larger project than what the 500K budget allows? I mean, that's an interesting question. I don't think we're calling this necessarily a planning grant, but for those who are awarded the funds, we are expecting them to develop a sustainability plan which means that, yes, you have this money to start doing this work, but we expect that during the time period that you are a part of the program, you will also be applying to subsequent grants to continue doing this work. So I wouldn't call the whole thing a planning grant per se, but it should hopefully be a foundation for the continuation of this work and for the application of, for applying for future funding moving forward.
And remember, there's only going to be 2 awards.
Yes.
This is Sean again. Just since you have time and I don't see any other questions, we have had a few meetings with the associations, and I've heard the question brought up over and over again about why IDPH chose to only offer 2 grant awards for a state as large as ours. Are you able to speak to that at all?
I'm not able to give details because I'm not IDPH. I do know that this is a pilot. And usually with pilots, we're trying to just test the waters and see how things work. But beyond that, I can't say much. I mean, we're hoping it's successful and more funds are available to do this work. But that's the best that I think we can give. I don't know, Lynette, if you have other thoughts to say.
And Sean, you've known me since I was in the tobacco program, and I do what I'm directed to do, so I do not know why that was chosen either.
Sure.
There's one more question. Does the 500,000 include indirect costs if a lead requests them? Yes, and there's information in the NOFO and in the glossary and budget about the indirect costs that you can do.
Yes.
I know some people have been emailing me with questions, and so I've been including those on the FAQ because this is a competitive grant and I strongly believe in an even playing field. So we'll have the slides, FAQ, and the webinar link posted to our website.
Do you know when those materials will be posted? I believe the FAQs are already available, but the slides and the recording might take a little bit more time.
Right, and we'll have to add, to the FAQ from today's call. So it'll at least be later this week, later near the end of the week or beginning of next week. Correct. We wanted to wait till after today's webinar before we can post the FAQ because we wanted to include today's questions on the FAQ. So once again, the slides, the FAQ, and webinar link will be posted to our website later this week.
This is Sean again. When you're determining the I believe they were called bonus points, the 9 bonus points, potentially an applicant could earn, if it's the lead agency, for example, qualifies for 6 out of 9 of those, but there's multiple counties involved in the collaborative. Do you base it on just the lead agency?
Yes.
I mean, I thought it was the lead agency.
Yeah, I mean, so if I'm understanding your question, San, if a collaborative has 2 or 3 counties coming together, when assessing those extra points, is it any of the counties or the county in which the lead organization resides? Is that your question, Sean?
Correct. Yes.
Yes, and it is the lead organization.
Okay.
And if the
great.
lead agency is not a local health department, correct me if I'm wrong, but then we would go with the local health department that is in that health equity zone. What they're, for the budget, for the, for how they're budgeting their money, which is an extra 3 points.
Yeah, for the third one. So um there's 3 kind of extra criteria or that we look at. The first one is counties that have the higher social vulnerability index. Again, that's based on the lead where it's located. Counties that are rural, again, that's also based on where the lead is located. And then the third one is about the lead organization being a local health department. And that's also centers around for the operating budget. It has to be when the lead is a local health department.
Oh, okay.
Yeah.
I'll just keep asking questions if no one else does. So for that determination, is there a way we can find where we fall? I mean, we are a local health department, so is there a way we can find where we fall in terms of um, comparable to other health departments throughout the state? Like, i- is there a site or somewhere we can go to determine if we're in that bottom 25%? For
No,
example, our organization's budget is about 5 million. Is that in the bottom 25%? Is it not? How would I find that out?
so we don't have the answer, but that is something that's going to be determined internally once applications are received. The reviewers with guidance will have information that will allow them to determine which local health departments have operating budgets below the 25th percentile.
Okay,
Right. Our fiscal staff is going to inform us of that, Sean.
gotcha.
And now the number of presenters outnumbers the attendees.
Do you have any other questions?
I assume that's for me. No,
Yes.
I'm good.
You're the
I'm
last
good.
person standing.
Okay, I will sign off now then if I'm the last person.
Okay, thank you.
Thank you.
I have a question.
Oh.
There's
Sorry.
another question. Christy, yes?
Yes. First of all, I still can't see the slides. So yeah, no, that's on me. The letter of support, you just want just information in terms of the partners, as far as that's concerned. And can we, I think I've asked them this question before, but just to make sure we can use one letter. Can we use one letter and have that signed by multiple partners?
We said yes, that you could do that on the last call. So yes, you can. But with your partners, we want a detailed detailed mentioned in the letter as to how they're going to be your partners.
Okay. All righty. All righty. Thank you.
You're welcome.
Bye.
Okay, so everybody else is UIC team and IDPH?
Is Pedro?
Pedro, do you have a question? Pedro?
Maybe to able and manually remove if as a host.
I don't know. I'm going to end the recording then. It seems like we don't have any other questions, so.